Facelifts and neck lifts can both help make you look younger, but they don't do the same thing. Stick around and I'll explain the differences to help you decide. What is a facelift? A facelift is a surgical procedure that can address excess wrinkling in skin on the side of the eye, the cheek, and the jowl. There are a number of options in regards to facelifts. A facelift can be a great option to address excess skin and wrinkling of the upper, mid, or lower part of the face. And then there are a number of different techniques in regards to how those structures are supported to give a more youthful look. This can include a SMAS lift or a deep plane facelift. What is a neck lift? A neck lift, broadly speaking, can address two different issues, mostly seen in younger patients versus older patients. Younger patients can have excess gland tissue, which gives the neck a more rounder appearance and lack of definition, whereas older patients commonly complain of a turkey neck or excess hanging skin in the middle of the neck. Whether the patient is young or old, we address extra skin, extra fat, tighten the muscles, and address the deeper structures that, if we trim them, can give a much better definition to the jawline. A good candidate for a neck lift can include anyone who has lack of definition under the chin, the jawline, has extra fullness, fat, or extra skin. How are facelifts and neck lifts different? The biggest difference is the area that's treated. The term facelift describes a procedure tightening the skin in the upper, middle, or lower face, which also includes the jowls. A neck lift will primarily treat excess behind the chin and in the central part of the neck. Traditional scars and incisions for facelifts will include the front of the ear, behind the ear in the crease, and along the lower hairs of the scalp. A neck lift will usually not include any incisions or scars in front of the ear. A surgical neck lift will have an incision behind the ear in the crease and along the lower hairline of the scalp. Often there will also be a small incision behind the chin to allow access to the central structures of the neck. The time for a neck lift surgery is about half as long as a facelift surgery due to the complexity of a facelift. Due to that fact, surgical neck lifts are less expensive than surgical facelifts. The first question I ask patients during the consultation is what's bothering them most. Once I hear that information, I can then give additional suggestions or opinions on the remaining skin of the face to maybe consider doing something in addition at the time of their surgery. Many patients will come for a consultation not fully understanding the options available to them. For example, many patients may have a problem with jowling, thinking that that would be fixed with a surgical neck lift. Once I examine them, I can point out the differences between a neck lift and a facelift and make sure that we're addressing all of their issues. A surgical facelift nor a surgical neck lift is a one-size-fits-all. I think combining a facelift with a neck lift can benefit many patients, as the amount of skin that can be removed is increased when adding the second component to the procedure. Something we see occasionally is when a patient chooses only one of the two procedures that may have benefited them, and then sometimes there is a bitter regret of not having it done at the same time. Just be sure to talk to your trusted plastic surgeon so you're guided in the right direction. What is healing like for facelifts and neck lifts? Many patients describe the recovery process from a facelift or neck lift as discomfort as opposed to pain, and many patients will use only over-the-counter pain medications. After a surgical facelift or neck lift, the patients have a soft compressive garment that remains in place until the following day, when I see them in the office and replace that with a simple Velcro chin strap that they'll wear for approximately 2 weeks. Post-operative recovery following a facelift and neck lift always includes a reduction in activity to reduce the additional risk of bleeding after surgery. Following a surgical facelift or neck lift, I always tell my patients to stay ahead of the pain with over-the-counter pain medications, stay fully hydrated, and to reduce strenuous activity. Following a surgical facelift or neck lift, patients can return to work as soon as a few days if they work from home, but if patients have to drive to the office, it would be at least a week or two. Whether you've had a surgical facelift or neck lift, the sutures are removed in approximately 1 week. Some patients may see some residual swelling for an additional few weeks, but most do not. After the sutures are removed at approximately 1 week, we'll follow up again with you at approximately 3 weeks to see how things are coming along. Some common side effects seen after a surgical facelift or neck lift often include some mild to moderate discomfort, some bruising, and some swelling. These side effects tend to be short-lived. The pain can be controlled with over-the-counter medications or some narcotics that we will also prescribe if needed. The swelling will resolve on its own for the first few weeks. If you have any concerns whatsoever following your recovery, always reach out to your surgeon to make sure everything is going along according to plan.